students will be performing your head to toe assessment today. Could you please verify your name and date of birth for me?
Zivo Stava 0114-2000.
Okay, can you tell me where you are right now?
I'm at the clinic.
And can you tell me what brought you in today?
Just for his physical.
Okay, so patient is ANO times 4. Patient appears to be well kept and is conversing appropriately. Patient's speech is clear and coherent, and there's no aphasia or slurring of the speech. Okay, so I'm gonna have you remember 3 words for me. I'm gonna ask you to repeat them back for me in a couple minutes. So could you remember apple, car, and dog?
Apple, car, dog.
Okay, so now I'm gonna be checking your recent and remote memories. So I'm gonna ask you, who was the first president of the United States?
George Washington.
And what did you have for breakfast this morning?
Cereal.
Okay, so recent and remote memory is intact. I'm now gonna have you repeat back those 3 words for me.
Apple, car, dog.
Great. And I'm gonna have you count back by 7s from 100.
193, 86, and 79.
Okay, perfect. So mental status examination is intact. I'm now going to be moving on to inspection of the head. So head is normocephalic and atraumatic. Inspecting the scalp. Scalp is clean. There's no scaling, no flaking, no lesions. Hair distribution is equal. I'm going to be palpating. Okay, there's no bumps and no masses. Any tenderness?
No.
Okay, so inspection of the face. Look at me. Okay, so face is symmetrical, no lesions, no rashes. I'm going to be checking for cranial nerve number 7, which is the facial nerve. So I'm going to be having you raise your eyebrows for me, frown, blow up your cheeks, and smile. Okay, so facial nerve 7 is intact. I'm now going to be palpating your temporal artery. Okay, the temporal pulse is 2+. Any tenderness?
No.
Okay, so moving on to the eyes. Do you wear glasses?
No.
Okay, so I'm going to be performing a visual acuity test. So this will also be checking for cranial nerve 2, which is the optic nerve. So I'm going to have you cover your right eye for me
Okay.
and read the bottom line.
LTFPH.
Okay, cover the other eye and read the same line backwards.
LTFPH.
Okay, now.
Oh, HPFTL.
Okay, and now uncover both eyes and read the same line.
LTFPH.
Okay, so visual acuity is 20/20 bilaterally uncorrected, and cranial nerve 2 is intact. Okay, so now I'm going to be inspecting the external structures of the eyes. So eyes are aligned and symmetrical, eyebrows and eyelashes are full and symmetrical, the eyelids are symmetrical with no signs of ptosis or lesions, no swelling, medial lateral canthus are intact with no signs of swelling or discharge, and the lacrimal system is intact with no signs of swelling or discharge. I'm now going to be pulling down on your eyelid, okay, pulling up. Alright, so the sclera is white bilaterally, no jaundice, no redness. Conjunctiva are pink and moist. The corneas are free of any opacities. The iris is brown and evenly colored, and the pupils are equal and round and 3 millimeters in diameter. Okay, so now I'm going to be performing the pupillary light test. So I'm going to be checking for direct and consensual response. Okay, so I'm going to be shining in your left eye, checking directly. Okay, now I'm going to be shining in your left and checking consensually in the right eye. Good. Now I'm going to be shining in your right, checking directly. Good. Now I'm going to be checking consensually, shining in your right and checking the left. Okay, so pupils are equal, round, and reactive to light directly and consensually. Now I'm going to be performing convergence. So I'm going to have you follow my finger, which is your eyes. Good, so eyes converge symmetrically. I'm now going to be performing accommodation. So I'm going to have you look at that image behind me, and now look at my finger. Okay, so pupils constrict at a nearby object and dilate at a far object, so accommodation is intact. Now I'm going to be checking for your extraocular eye movements, which will also be checking for cranial nerves 3, 4, and 6, which is the ocular motor, trochlear, and abducens nerves. So follow my fingers with just your eye, okay? Eyes. Okay, so extraocular eye movements are intact. Cranial nerves 3, 4, and 6 are intact. And no nystagmus noted. I'm now going to be checking for your peripheral vision using the confrontation test. So can you please fixate on my nose? Cover your right eye. And now, do you see my hands? Let me know when you see them.
Okay. Yes.
Do you see my hands?
Yes. No.
Let me know when you see them.
Yes. Yes.
Good. Cover the other eye. Keep looking at my nose. Let me know when you see my hands.
Yes. Yes. Yes.
Okay, so peripheral vision is intact. All right, now I'm going to be doing the fundoscopic exam to check the internal structures of your eyes. So I'm going to be turning up the lights. Okay, so checking your right eye with my right eye, right orange reflex is intact. Okay, so the lens is free of any opacities. Retinal vessels are intact with no signs of AV nicking. The optic disc is visualized and sharp. The macula is visualized and sharp with no lesions. And the cup to disc ratio is 0.3. Okay, checking your left eye with my left eye. Red-orange reflex is intact. Okay, so lens is free of any opacities. Retinal vessels are intact with no signs of AV nicking. Cup to disc ratio is 0.3. The macula is visualized with no lesions, and the optic disc is sharp and intact. Okay. All right, moving on to the nose. I'm going to be checking for patency, so I'm going to occlude one nostril. Take a breath. Okay, I'm going to occlude, take a breath. All right, so nostrils are patent. I'm now going to be checking your smell test. I'm going to be checking for olfactory nerve, which is cranial nerve 1. So I'm going to have you close your eyes. I'm going to cover your nostril, and I'm going to ask you what you smell, okay? What do you smell?
Strawberries.
Okay, what do you smell?
Vanilla.
Great, so olfactory nerve 1 is intact, smell is intact. Okay, now I'm going to be palpating the nose, okay? Any tenderness?
No.
Okay, palpating the maxillary sinus, any tenderness?
No.
Frontal sinus, any tenderness?
No.
Okay, so that's normal. I'm now going to be checking the inside of your nose. Okay, so I'm going to be lifting the tip of the nose. Alright, so nasal mucosa is pink and moist. There's no discharge, no lesions, no redness, no swelling. There's no septal deviation, no perforation or polyps. Okay, looking into the right nostril, lifting up the tip. Nasal mucosa is pink and moist, no swelling, no lesions, no redness, no discharge, no deviation of the septum, no perforation, and no polyps. Okay, moving on to the mouth. So the lips are pink and moist, there's no lesions, no swelling. Can I see your gums? Okay, so gums are pink and moist, there's no inflammation, no bleeding. Can I see your teeth? Teeth are all intact. Okay, I'm going to be checking your buccal mucosa. Open up for me. Okay, so buccal mucosa are pink and moist bilaterally, no lesions. Can I check your hard palate? All right, so pink, no lesions, no swelling. I'm going to be checking for your hypoglossal nerve, which is the cranial nerve 12. So I'm going to have you stick out your tongue for me. Okay, so tongue is midline. I'm going to have you bring your tongue back and forth. Yeah, it's from side to side. Sorry, side to side. Okay, now lift it up for me. Okay, great. Can you say light, tight, and dynamite?
Light, tight, and dynamite.
Okay, so cranial nerve 12 is intact. I'm now going to be checking for cranial nerves 9 and 10, which is the vagus and the glossopharyngeal nerves. So I'm going to have you say ah for me. Okay, so the uvula and soft palate rise symmetrically. I'm going to be checking your gag reflex. This might be a bit uncomfortable. Okay.
Ah.
Okay, so gag reflex is intact. So cranial nerves 9 and 10 are intact. I'm now going to be checking for your tonsils. So open up for me. Say ah. Okay, so tonsils are visible. They are 1+. There is no swelling, no exudate, no redness. They are pink and moist. Okay. Okay, now I'm going to be moving on to the ears. Okay, so I'm going to be doing a quick hearing test on you. This will also be checking for cranial nerve 8, which is the vestibulocochlear nerve. So I'm going to have you close one ear for me. I'm going to come behind you and tell me what you hear, okay? 1, 2. Okay. Same with the other ear. Can you cover it? Tell me what you hear.
ABC.
Okay, so cranial nerve 8 is intact. Gross hearing is intact. I'm now going to be performing the Weber and the Ryan test to check for any hearing loss. So I'm going to be performing the Ryan test first. So please tell me when you stop hearing the vibration. Okay, so I'm going to be placing this on your mastoid process.
Stop. 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 Stop.
Okay, so air conduction is greater than bone conduction. I'm now going to be checking the Weber test. So please let me know if you hear the vibration louder in one ear or the same. Same, okay, so there's no lateralization, no sensorineural hearing loss. Inspecting the ears are midline, symmetrical, there's no nodules, no lesions, no redness. Okay, so I'm going to be palpating your tragus. Any tenderness? Your mastoid process, any tenderness? I'm going to be pulling your pinnas up and back. Any tenderness? Okay. Now I'm going to be checking the inside of your ear. So checking the right ear. I'm going to be pulling the pinna up and back. Okay, so checking the inside. So there is minimal ceramin. Ear canal is clear. There is no redness, no swelling, no inflammation, no lesions, no masses. Tympanic membrane is visible, pearly gray. There's no scarring, no perforations, and no bulging. Cone of light is at 4 o'clock, and the pars flaccida and malleus are visible. Okay, checking the left ear. Okay, so there is minimal ceramin. Ear canal is clear. There is no swelling, no lesions, no redness. The tympanic membrane is visualized, pearly gray. No bulging, no perforation, no scarring. The cone of light is at 8 o'clock, and the malleus and pars flaccida are visible. Okay, I'm now going to be moving on to the neck. So the neck appears to be symmetrical. There's no swelling, no abnormal pulsations, no discoloration. I'm now going to be palpating your lymph nodes. Let me know if you feel any tenderness. So the preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and the supraclavicular. Any tenderness?
No.
Okay. I'm now going to be checking for tracheal deviation. Okay, there's no deviation. Trachea is midline. I'm now going to be coming behind you to check for your thyroid. So I'm going to ask you to swallow for me. Okay, so there's no goiter, no enlargement, no nodules. Thyroid feels symmetrical. Do you have any tenderness?
No.
Okay, so thyroid is normal. Now I'm going to be moving on to the chest. So inspecting the anterior chest. Chest is symmetrical. There is no retractions, no bulging of the chest. Chest expansion appears to be symmetrical. There is no labored breathing. Apedolateral diameter is 1 to 2. There is no barrel chest. I'm now going to be palpating. Any tenderness? No bumps, no masses. I'm now going to be percussing the chest. Okay, so resonance was heard at all fields. I'm now going to be auscultating the anterior chest. Take a breath for me whenever you feel my signals. Okay, so normal breath sounds, no adventitious breath sounds were noted upon auscultation. I'm now going to be moving on to your posterior chest, so maybe this expires. Okay. So inspecting the posterior chest, it is symmetrical. There is no lesions, no discoloration. I'm going to be palpating. Any tenderness? No bumps, no masses. I'm now going to be checking for tactile fremitus. So please, whenever you feel my hand, say 99. Okay, vibration was felt at all fields. I'm now going to be checking for chest expansion, so please take a deep breath for me. Okay, chest expansion is symmetrical. I'm now going to be percussing. Okay, resonance was heard at all fields. I'm now going to be performing diaphragmatic excursion. So I'm going to have you take a deep breath and hold it. Dullness noted. I'm now going to have you exhale and hold it. Dullness noted. Diaphragmatic excursion is 4 centimeters. I'm now going to be auscultating your posterior chest. So whenever you feel my stethoscope, just take a breath for me. So no adventitious breath sounds noted. I'm now going to be checking for consolidation. So whenever I'm going to be performing echophony. So whenever you feel my stethoscope, just say E. Okay. I heard E and not ah, so no consolidation. I'm now going to be performing whispered ventriloquy. So whisper 1, 2, 3 whenever you feel my stethoscope. Okay, so the 1, 2, 3 was muffled with no signs of, they were muffled and not heard clearly, so no signs of consolidation. You can sit back for me this way. I'm going to be moving on to the cardiac portion of the exam, so I'm going to be checking your blood pressure. Okay? Okay, so I'm going to be placing this at the brachial artery. And I'm going to be placing the diaphragm of my stethoscope. Okay, so checking the blood pressure. Okay, so blood pressure is 120 over 70, which is normal. I'm now going to be checking your radial pulse. Thank you. I'm now going to be checking your radial pulse for 15 seconds. Okay, so radial pulse was 72, which is normal, and I was checking your respirations while taking it, and it was 16, which is also normal. So now I'm going to be moving on to inspecting the cardiac landmarks. Okay, so at the right sternal border, second intercostal space, we have the aortic valve. At the left sternal border, second intercostal space, we have the pulmonic valve. At the left sternal border, fourth intercostal space, we have the tricuspid valve. And at the left mid-axillary line, fifth intercostal space, we have the mitral valve. So now I'm going to be auscultating on fields using my diaphragm and my bell. Okay, so checking the aortic, pulmonic, tricuspid, and mitral. Using my bell. Wonderful. So S1 and S2 were auscultated and no murmurs were heard on auscultation. I'm now going to have you lean forward from me, and I'm going to be auscultating your mitral area. Okay, perfect. So I heard S1 and S2 and no murmurs were heard on auscultation. Okay, so now we're going to be moving on to the neck. So I'm going to have the head of the bed at 30 degrees. I'm going to have you lie down for me. Okay, so the neck is symmetrical. There's no visible pulsations, no lesions. Okay, I'm going to have you turn to the left for me. Okay, so, all right, so there's no JVD. I'm now going to be palpating your carotids. Alright, carotids are present and 2+ bilaterally. I'm now going to be auscultating them with my bell to check for any bruits. Okay, no bruits were heard on auscultation. You can stay down for me. Okay, so now I'm going to be putting you completely flat. Can you please stop for me? Okay, so now I'm going to be palpating the chest for any heaves or throws. Okay. Alright, so no heaves or throws on palpation. I'm now going to be checking the PMI at the left left midclavicular line, fifth intercostal space. Okay, so the PMI is located and it is non-displaced, which is normal. Great, you can sit up for me. All right, now moving on to the vascular system. I'm going to start off with inspection. There's no cyanosis, no redness, no ulcers. There's no clubbing of the nails. There's no edema and no edema of the skin. All right, great. So now I'm going to start off with palpating your pulses. So I'm going to start off with the brachial pulses, your radial pulse, okay, your femoral pulse. Sorry, so femoral pulse is right here. Okay, now I'm going to be checking your okay, so the dorsalis pedis pulse, okay, and the posterior tibial. Same with this one, dorsalis pedis and posterior tibial. Okay, so pulses are 2+ bilaterally in the upper and lower extremities. I'm not going to be checking for any bruits, so I'm going to have you lie flat for me one more time. Okay, so is it okay if I lift your shirt? So I'm going to be auscultating the abdominal aorta for any bruits. Okay, so no bruits. Now checking the renal arteries and the femoral arteries. Great. So I did not hear any bruits on auscultation. You can stay flat for me. I'm going to be moving on to the abdomen. So I'm going to just expose the area. Is it okay? Bring this down a little bit for me. Great. So upon inspection of the abdomen is flat. It's symmetrical. There's no lesions, no discoloration, no striae. I'm going to be auscultating your quadrants now, checking for vowel sounds. Okay, starting at the right lower quadrant. Right upper quadrant, left upper quadrant, and the left lower quadrant. Perfect. So normal active vowel sounds were heard at all locations, at all quadrants. So I'm now going to be percussing. Okay, so I'm going to start percussing at the right lower quadrant. Okay, so I'm going to percuss the right lower quadrant, right upper quadrant, left upper quadrant. Perfect, left lower quadrant. So timpani was heard at all quadrants. I'm now going to be performing, I'm going to be checking for your liver borders. So I'm going to be percussing down the midclavicular line. Okay, dullness noted. I'm not going to be coming up. Okay, dullness noted. So the liver measures 6 centimeters, which is normal. I'm not going to be percussing the spleen, so I'm going to come to the left side at the left mid-axillary line at the 5th intercostal space. Okay, so I'm going to percuss down. Okay, perfect. So spleen measures 7 centimeters, which is normal. I'm now going to be performing light palpation. Let me know if there's any tenderness. I'm starting at the right lower quadrant. Any tenderness? Okay, now I'm going to be performing deep palpation. Tell me if there's any tenderness, okay? No? Okay, and no bumps, no masses. So on deep palpation. Now I'm going to be palpating for the liver, which is at the right upper quadrant. So I'm going to have you inhale and take a deep breath. Yeah, hold it for me. Okay, perfect. So liver is palpable, which is normal. I'm now going to be palpating for the spleen at the left upper quadrant. So, okay, so spleen is not palpable, which is normal. I'm now going to be palpating your inguinal nodes. Okay. Okay, so palpating. There's no bumps, no hernias. Any pain or tenderness? Okay, you can sit up for me. I'm going to be checking your costovertebral angle tenderness. Okay, so I'm placing my hand on your back, on the flanks, and I'm going to hip. Any pain? No. Okay, Now, once again, any pain?
No.
Great. So no pain elicited, no CVA tenderness. Perfect. Okay, so now we're going to be moving on to the musculoskeletal portion of the exam. So I'm going to have you get up for me. And I'm going to just have you walk back and forth so I can check for your posture and gait. Perfect. So patient's posture and gait is stable, normal. She's not swaying. She's very balanced. Okay. So now, if you can stand right here, I'm going to be inspecting your spine, so you can turn around. So the spine is normal curvature. There's no lordosis, no kyphosis, no scoliosis. I'm going to be palpating the spine. Any tenderness?
No.
Okay. Paraspinal muscles. Great. No tenderness.
No.
Great. I'm not going to be checking for range of movement of the back, so I'm going to have you touch your toes for me. Okay. Now you can extend backwards. Good. Now can you go from side to side? Okay, great. So there's full range of movement of the spine. Now I'm gonna have you sit. I'm gonna be checking for your temporomandibular joint. Okay, so I'm gonna be palpating any tenderness. No, so there's no redness, no warmth, no swelling, no crepitus. I'm not gonna be checking the range of movement. So can you open your jaw for me? Move it from side to side, and now protrude and retract for me. Perfect. Okay, so full range of movement of the TMJ. Now I'm going to be moving on to the neck. Okay, so cervical spine, normal curvature. There's no swelling, no redness, any tenderness.
No.
Okay, so now I'm going to be checking the range of movement of your cervical spine. So I'm going to have you bring your chin to your chest, put it back toward the ceiling, go from side to side like this. Yeah, put your ear to each, and now look over your shoulders. Okay, so there's full range of movement of the neck. Now with the shoulders, I'm gonna have you stand up for me. Can you just bring them behind you like this? Like just sway them, yeah. Perfect. So now I'm gonna be checking for abduction and external rotation. So I'm gonna have you bring up the shoulders and now touch each scapula, the opposite scapula. Perfect. Now I'm gonna be checking for internal rotation and adduction. So do the opposite, so go behind, yeah, touch the opposite scapula. Great, so shoulder range of movement is intact. Now moving on to the elbows, you can sit down for me now. Okay, so I'm just palpating the shoulders. There is no crepitus, no swelling, any pain?
No.
Okay, so now palpating the elbows. Okay, there's no crepitus, no fluid, no redness, no any swelling or tenderness?
No.
Okay, good. So now I'm going to be checking for your range of movement. So I'm just going to have you pronate, supinate, yeah, and now you can just flex and extend. Flex and extend each elbow. Perfect. So full range of movement of the elbows. Now moving on to your wrists. I'm going to be palpating your wrists. There is no swelling, no crepitus, no fluid, any tenderness.
No.
Okay, so I'm just going to have you pronate your arm and then bring the wrist, to the hands, now to the bottom floor. We'll do it with the other hand too. And then just go around and around. Rotate. Good job. Now I'm going to be moving on to the hands. All right, so checking the fingers. There is no nodules, no swelling, no redness. I'm going to be performing passive range of movement of the fingers. Perfect. There is no stiffness. Okay, great. I'm going to have you make a fist. And now touch each finger to the thumb. Okay, perfect. Great. So there's full range of movement of the hands. Now I'm going to be checking your lower extremities. So moving on to the hips. So palpating the hips. There is no swelling, no tenderness. Any tenderness? Okay, no, and then no crepitus, no fluid. I'm going to have you lie down for me. Oh, okay. So can you extend your, flex your knee. Flex it, hold it with your hands, and bring it to your chest. Good? Do it with your other one too. Perfect. Now I'm going to be, can you flex it one more time? I'm going to be checking for, I got it. So I'm going to be performing external rotation, internal inwards. Perfect. Now I'm going to be checking, you can put it straight. I'm going to be abducting and adducting. Here. Perfect. Okay, so hip range of movement is intact. I'm now going to be checking your knees so you can sit up for me. Okay, so the knees are normal. There is no swelling, no fluid, no bulging, any tenderness?
No.
Okay, no crepitus. Now, to check the range of movement, can you just bring each knee up to the ceiling? Perfect. Go with the other one. Great. Okay. Now moving on to the ankles. Okay, so there is no swelling, no redness, and any tenderness?
No.
Okay, great. So for the ankle, you can do round and round. Do rotate, yeah, good job. And now I'm gonna be moving on to the feet. Okay, so checking the metatarsals. I'm gonna take off this. Okay, so metatarsals are intact. There's no bunion, no nodules, no swelling, no redness. Okay, perfect. Now for your foot, I'm gonna have you just bring it up for me and point your foot toward you. Good. So I'm checking plantar flexion and dorsiflexion. So now point it toward the floor. Bring them inwards. Good, and bring them outwards. Okay, great. All right. So we did that. Okay. So now moving on to the motor. Okay. Okay. So for the motor part, we're going to be. I'm going to be having you stand up for me. Great. So I'm gonna be checking for upper extremity drift. So I'm gonna have you close your eyes, yeah, and hold it like that. Good. Now I'm gonna be checking. Perfect. So there's no unilateral drifting of any arm. It is balanced and stable. Perfect. Okay. So now moving on, you can sit down for me. I'm gonna be checking your trigeminal nerve, which is cranial nerve 5. I'm gonna be checking the motor aspect. So I'm gonna have you clench your teeth. Okay. Clench your teeth. Great. So now I'm gonna try to push against resistance and be opening it. Good. So 5 out of 5 strength. Now I'm gonna be palpating the masseter and the temporal muscles. Great. So they are contracted, which is good. Now we're gonna be moving on to the neck. So I'm gonna have you try to move your neck against my resistance. Okay. So move it to the left. Good. Move it to the right. Okay. Move it down. Okay. And now move it up. Perfect. So cervical strength is 5 out of 5. Okay, now moving on to the shoulders. So this is also going to be checking for cranial nerve 11, which is the spinal accessory nerve. So I'm going to have you shrug your shoulders against resistance. Perfect, 5 out of 5 strength. Moving on to the elbows. Pick up your elbows for me like this. Try to put them down against resistance. Perfect. Try to put them up against resistance. Perfect. Now your wrists. 5 out of 5 strength of the elbows. Now your wrists. Push up. Wrist up against. Perfect. Now down. Awesome. 5 out of 5 strength of the wrist. Now give me your hands. Okay. Try to push down on my hand. Perfect. Other hand. Now push up. Okay. Push up. Okay. So 5 out of 5 strength of the hands. Okay. Now I'm gonna be moving on to your hips. Okay, so you can lay down for me. Okay, so you can lift up your leg for me. Just you can put it straight. Okay, now try to push down against resistance. Now push up against resistance. Perfect. 5. Other leg, lift it up for me. Push up, push down. Okay, push up now. 5 out of 5 strength of the hips. Now for the knees, I'm gonna do the same thing. Push down for me. Great. Push up. Other knee. Okay, perfect. 5 out of 5 strength of the knees. Now with the ankles. Okay, push up, push down. Sorry, push down, push up. Okay, same thing. Push down, push up. Okay, 5 out of 5 strength of the ankles. Now for the feet. Same thing. Push down, push. Yeah, perfect. Push down. Okay, now you're gonna push up for me. Okay, so 5 out of 5 strength for the feet. Okay, now you can sit up. I'm going to be performing the sensory aspect of the exam. So the first thing I'm going to be testing for is pain. So I'm going to have you close your eyes and you're going to tell me where you feel the stimulus of pain. Okay? Close your eyes for me.
On my right hand. I feel it on my shoulder. Right shoulder. Left hand. Left shoulder.
Okay, so now I'm going to be doing light touch sensations. So do the same thing. Tell me where you feel it, okay?
Left hand. Right hand. Right shoulder. Left shoulder.
Okay, great. So now I'm going to be doing a sharp and dull test on you. So I'm going to be showing you what they both feel like, and you're going to tell me what you feel and where you feel it, okay? Close your eyes for me. This is gonna be the dull. This is gonna be the sharp. Okay. So tell me what you feel.
Like, dull, sorry. Dull. Sharp. Dull. Sharp.
Okay. So sharp and dull sensation is intact. Now I'm gonna be performing the vibratory exam. So tell me where if you feel the vibration and when it stops. Okay.
Stop. I feel it on the right hand.
Okay. I'll do it again.
On the right leg.
See, what do you feel?
Vibration.
Okay, tell me what you feel and where you feel it.
Left hand. I feel the vibration.
Good.
Left leg and I feel the vibration.
Okay, great. Alright, now we're going to be performing stereognosis. So I'm going to be placing an object into your palm and I'm going to have you tell me what it is, okay? So open up your palm. Tell me what this is.
Pen.
Great. Tell me what this is.
Cotton swab.
Wonderful. So stereognosis is intact. So I'm now going to have you, I'm going to be checking for your balance and coordination. So I'm going to have you stand up. And I'm going to be checking your heel to toe coordination. So look straight and walk heel to toe. Okay, now walk back. Perfect. So heel to toe walking is balanced. There's no swaying. Okay, so now I'm going to be asking you to walk on your toes and on your heels. So walk on your toes this way, looking straight. Okay, now walk with your heels. Perfect, so she is balanced, good coordination. So now I'm going to be having you sit down. We're going to be checking for nose to finger coordination. So whenever you see my finger, just touch your nose and touch my finger, okay? Okay, perfect. All right, so now we're going to be performing the heel to shin test. So I'm going to have you lie down. You're going to take your heel and you're going to run it down your shin on each leg. Okay? Perfect. So heel to shin test is intact. Now we're going to be performing the Romberg test. So I'm going to have you get up for me. I'm going to have you just lean. Okay, so pretend this is a wall. So, okay, so come away. I'm going to stand in front of you. Close your eyes. Keep your arms behind you. And now I'm going to be checking for your proprioception, for your balance. Okay, perfect. She is balanced. She has a negative Romberg test. Wonderful. Okay, great. So now I'm going to be checking for your reflexes. So I'm going to have you sit down for me. Okay, so first I'm going to be checking your, I'm going to go on this side. I'm going to be checking for your bicep reflex. Okay. Now I'm going to be checking for your triceps. So could you just hang, just relax, okay? Okay, so that was the tricep. Now brachioradialis. I'm gonna have you just flex for me so I can, okay? Okay, perfect. Now I'm gonna be checking your quadriceps patellar. So just dangle your knee, relax it, okay? Relax, yeah. Perfect. And now I'm gonna be checking your Achilles ankle. So reflexes are 2+ in all locations. I'm now going to be checking your Babinski reflex. So I'm going to have you lie down and I'm going to be checking the sole of your foot. Okay, so I'm going to be making a J motion. Okay, perfect. So toes curl inward and not outward. So this is a normal Babinski reflex. Okay, so this concludes our head to toe assessment. Thank you so much for your time.